Hello friends, I'm Dr. Parul Shah. I'm going to speak today on protecting and taking care of your eyesight. I'm really thankful to Centene for giving me this opportunity to tell all my patients and friends how to take care of their eyes. This is a month of a World Sight Day. Actually, the World Sight Day was on 8th October, but whole month we have lots of webinars and the importance of World Sight Day. Why? Because vision is so important. Vision is a window to the world, and we connect with vision with our eyes to the others, and we feel happy. 80% of our memories are determined by what we see generally. Now, why the World Sight Day? Because it's an annual global event which draws attention on blindness and vision impairment. The objective is to create the eye awareness about how to take care of your eyes and how to maintain your vision and how to treat different eye diseases which can be easily cured and blindness can be prevented. So today we are going to focus on paying attention to leading causes of blindness and visual impairment like cataract, glaucoma, diabetic retinopathy, and refractive errors, which can be treated, and if diagnosed in advance, then we can prevent the blindness in the society. Uh, Globally, there are 2.2 billion people who are visually impaired or blind, and out of which 1 billion people have the blindness which could have been easily been avoided or could have been treated if they were addressed early. And we require lots of corneas also for any corneal opacities, the corneal transplants. For making a blind people see, we require approximately 1 lakh of corneas in India, which we receive by eye donations. But we get at present only 25,000 eyes where we can do the cornea transplant. So still there is a big, huge gap between the corneal transplantation and requirement and the supply. So I pledge everybody to do lots of eye donations. Now, to understand that basic, that how do you see generally, how the image has been produced and how we see a visual image. Actually, when the parallel rays of light, like consider this is a candle, when it passes, this is the cornea, which has got a plus or refractive surface, and there is a clear lens inside, both, which is also convex with positive power, which converts the rays of light and focuses it on the retina. And on the retina, an inverted image is formed, which then transmitted by the optic nerve. This is the optic nerve to our brain, and the brain interprets it to be the final image, which will be again a virtual and which will be erect. So basically there is a whole pathway right from your cornea till the brain, and this pathway has to be completely intact for a person to see an object clearly. Now, just a brief anatomy of the eye. You can see that eye is a closed structure. It's like a ball. And what transparent structure in the front is the cornea. Then you have a gap, which we call it an anterior chamber, which is filled with the fluid. And inside, again, this is a vitreous gel, which is filled with the fluid. And there are two surfaces which has got a plus power and which are responsible for converging the parallel rays to the retina for us to see the object clearly. So this is the lens and this is the cornea, and then this is a vitreous cavity, and this is lined, eyeball is lined with the retina and a choroid, and after this retinal fibers are passing through the optic nerve to the brain where the image is perceived. Now, what are the common eye problems? There are certain eye problems which are common in children and adults. So, which is one is the refractive errors, where you can have a myopia, hyperopia, astigmatism, or dry eye, allergic conjunctivitis, eye infections, or nowadays because of lots of screen usage, you have a digital strain in the eyes. There are certain problems which are common in children, like refractive errors, mainly the myopias, then lazy eye, strabismus, that is squint, ptosis, which is a drooping of your eyelid, and allergic or a seasonal conjunctivitis. And there are certain problems which are common in older age group, which is presbyopia. We all know that after 40, 42 years, everybody requires a reading glasses. So that is known as presbyopia. Then you have a cataract, which is an age-related problem most of the time. You have a glaucoma, which is known also as Jhamar in Gujarati, Kala Pani in Hindi, and Kach Bindu in Marathi. There is something like age-related macular degeneration. As we know now, that longevity of a person has increased thanks to our modern medicine. And now we are coming across lots of age-related macular degenerations. And other thing is diabetic retinopathy, which is very common nowadays. Now, first we'll go to the refractive common problems, that is a refractive error. One is myopia. Myopia is also known as nearsightedness. Now, this develops in a children at the age of 2-3 years, and which slowly progresses and the power increases and it stabilizes once a child reaches the adulthood, which has got a genetic component and it affects major part of the population. Nowadays, myopia has become more common thanks to our digital world. We have an advantages of a digital world, but at the same time, children don't go outside and play. They are always working their eyes to a close distance. They are always on a screen, either a mobile or an iPad or a TV or a computer. So they don't get vitamin D. They don't go out. Second thing is they are always converging their eyes for a closer distance. And that is a major cause of myopia increasing very fast in recent times. So one should encourage children to go out and play and do the outdoor games to prevent the progress of the myopias in a children. The symptoms are that they cannot see the far, the near vision is clear, but they cannot see the distance clearly. And how you come to know? The commonest sign is that the children, when you tell them to watch the TV from far away, they'll go in front of the TV, close to the screen and see it. The reason, because they cannot see from the far. Then the parents should become alert and bring them to an eye surgeon or any optometrist. Other thing is they start squinting their eyes and they also complain of headaches. The reason, because the eyeball is bigger in the size, the image is posterior. Now, how do you correct myopia? Simple thing is spectacle correction. Then after the child grows, they can take care of themselves. You can give them contact lens correction. And after 18 years, you can do even a refractive surgery, which is commonly known in population by LASIK surgery. You can do a clear lens extraction. That is something like how you do a cataract, remove the cataractous lens, you remove the clear lens. This we do in very high myopes where we cannot do a LASIK or we cannot give a contact lenses. Or we can do a phakic IOL. Phakic IOL is nothing but intraocular contact lens. Now, hypermetropia. Hypermetropia occurs, which is also known as farsightedness, where generally happens in an older age group over the age of 35 years. Very rarely it happens in children, but at birth, the babies are always born slightly hyperopic, but as their eyes grow, then it gets corrected and fixes itself. Here, the eyeball size is smaller. So the length of the eyeball is smaller. So the image here, instead of focusing on the retina, it is focused in front, behind the eyeball. And that is why you require a converging lens or a plus lens to correct this hyperopia. The common complaint is they get headache and they cannot see the near clearly. So they have lots of difficulties in reading, but their far distance is quite clear. There's something like astigmatism. Our cornea is like a cut section of a sphere in an ideal cornea, but nobody has an ideal cornea. So one of the curvature, either horizontal, vertical, or at the angle, is different from the other. So it is like a parabolic shape, or like it's like a cylinder. So that is known as an astigmatism. Here again, image, instead of focusing at one point on retina, gets defocused, and that's why a person sees little blurred, which can be corrected easily with glasses or with contact lenses. And generally complain is the headache, eye strain, blurred vision, and difficulty in driving at night. Everybody gets presbyopia after the age of 40 years. What happens that after 40 years you develop a farsightedness. So because the lens which is supposed to focus your rays of light, that because of its elasticity, it loses its elasticity, and that is why you require now reading glasses to see at the close distance. There is one common disease in a children is amblyopia, which can be easily treated. God has given us two eyes, and both the images go to the brain, and in the brain we perceive it gets, both the image gets focused and we see a one image, but two different images from two different eyes goes to the brain. Now this image quality has to be of the same type. If one of the image is blurred and one of the image is clear, which happens when one of the eye has more number than the other eye, then what happens that fusion cannot occur at the brain level. The brain gets confused. So brain is very smart. It perceives only the clear image, and the image which is blurred or which is hazy has been ignored. And so what happens that eye becomes a disuse atrophy, what we call it a lazy eye or an amblyopia. So person can uses only the eye which has got a good vision. This normally happens when your number, there is a great difference in the refractive error, the glass number in both eyes, which is more than 2 or 3. Now, this binocular vision, meaning in spite of having two eyes, we see the one image, the development of it gets completed by 13 or 14 years of age. So till then, you can treat this amblyopia by patching a good eye so that the brain is compulsorily has to use the eye which is open, and this way we can treat the amblyopia. So basically in a lazy eye, anatomically and physiologically, eye is absolutely normal, but because the eye is not being used, it goes in a lazy phase, and which can be treated within 13 years of age. And that is why the importance of a children to take to an eye specialist for a regular eye checkup, because it has to be diagnosed early. Other commonest children problem in children is a squint. Now this squint, there are multiple causes of it. The commonest causes is that if you have a plus number in one eye which is more, then that eye can go in a squint which goes inside. If somebody is myopic, where you have a squint where the eye turns outside, and if you correct this refractive error with glasses, then partially the squint gets corrected. If it doesn't get corrected, that means one has to operate the children. It should be operated as early as possible, because the moment the children start squinting, they're using only the one eye at a time. And because they're using only one eye at a time, the other eye which is squinting is not used, and that's why it becomes lazy. So basically they start getting double vision, blurry vision. So treatment option is you give glasses, you give the surgery to correct the squint and bring the eye back to its normal position, and at the same time you give little exercises, and you have to do an amblyopia treatment if amblyopia is occurred because of the squint. So the surgery is the common treatment, and it should be done as early in a childhood as possible to prevent lazy eye. Ptosis is nothing but a drooping of the eye. Normally in a children it happens, it is congenital, it can be hereditary, and in adult also the ptosis can occur because of certain diseases or due to the injury, which should also be treated surgically. The only treatment is surgery. Corneal ulcers. Corneal ulcers are the result of an infection in the eye, that is the cornea, and initially it is a small infection which is known as keratitis. If not treated in time, then it can develop into a corneal ulcer or an abscess. It commonly caused by infection like bacterial, viral, fungal, or parasitic, or it can occur also after the injury. Because of the injury, the cornea can catch the infection very fast, and initially patient will only get a redness, lots of watering from the eyes. They'll get a thick pus like discharge. They cannot look at the light, that is known as photophobia. The lid also may be swollen, and there may be pain. They should immediately go to an eye specialist and treat immediately, because if not treated well in time, then the infection can spread in the inside of the eye, and you can lose your vision permanently. Conjunctivitis, commonly known as a pink eye, which is an inflammation of a transparent membrane known as conjunctiva, which lines your eyeball and the eyelid. The small vessels in the conjunctiva becomes inflamed, they become red, they become dilated, and that's why it becomes more visible and the eye appears red. Now, this is commonly caused by either bacterial or viral infection. If it is a bacterial infection, you will get little discharge from your eyes. And if it's a viral infection, you will get a simple watering from your eyes. And these are infectious. If it is bacterial or viral, that means you can contaminate other members in the family or at your workplace. So you have to be very careful. If you develop a conjunctivitis, you should wash your hand very now and then. You should not touch your eyes, and in the home you should keep your eye towels, eye napkins separately to prevent the contamination to the other people. Very rare in a seasonal, like because of the pollen, you can also develop an allergic conjunctivitis, which is more common and which is more seasonal, which is not contagious. In here, there will not be any discharge in allergic conjunctivitis, but patient will have a simple watering of the eyes and redness of the eyes, and they will get a pricking sensation in the eye. Now, this is an ocular allergy known as vernal catarrh, or you can tell it as a allergic or atopic keratoconjunctivitis, and which has to be treated well, and it can occur in a children, which is very common, and it is seasonal. And the moment your eyes develop dry, they catch an infection very fast. So you should see that you should lubricate your eyes very well with either artificial tears. The moment you develop some infection, start putting an artificial tears and consult your eye surgeon. Now, in elderly age group, cataract is the common thing. It is an aging process. It is not the disease. There is nothing new developing in a cataract, but a clear lens, which all of us have, which has got a plus power and which converges the rays of the light to the retina for us to perceive the image clearly, becomes opaque or a cloudy. So instead of rays focusing on the retina clearly, they start scattering. And because of the scatter effect, the image will appear blurred. You can see this is a clear image and this is a blurred image which a cataract patient sees. Second sign is that here the clear, you can see the colors very clearly. Here you can see that the contrast is gone, the color contrast is gone, and the colors are appearing very dull. So known as Motia, Motibindu in Hindi and Motio in Gujarati, which happens in most of the people at the old age, generally happens after 55 years of age. It happens very fast and early age if you have certain diseases like diabetes, if you are taking lots of alcohol, if you are taking certain drugs like corticosteroids, either in a topical forms, drops, or systemic steroids, are known to cause an early and complicated cataract. High exposure to UV light in Asian countries, exposure to the sun you can develop a cataract very fast. So it is advisable to use a good UV protecting glasses, that is the goggles, in those countries, the tropical countries where you have a very strong sunlight. A poor nutrition, smoking can also lead to an early development of a cataract rather than an old age. Certain hormone therapy can also give rise to an early cataract at a very younger age. Even children can get a cataract. There is sometimes something like congenital cataract. So at birth, they have a cataract because of genetic mutation. And sometimes you can have a developmental cataract with a child develops a cataract after 7 or 8 years of age, or at the age of 10 to 15 years also. But 80 to 90% of the time it is a senile cataract. Now, how do you know that you have developing a cataract? This is a common question. So you get a blurring of the vision, cloudy vision, your color contrast is gone. See, now this is the normal vision and this is the blurry vision. The colors, when you can't see the colors clearly, like the blue color appears gray color, or a red color appears like a pink color, you should understand that you must go to an eye surgeon because you could be developing a cataract. Then at the night vision is gone, and sometimes you have a central cataract. So very strong light, suddenly you have a blinding effect. And colors, as I told you, appears faded. Or you have a frequent change of your glass number. Every 3-4 months, your number changes. Then you know that you may be developing a cataract. So at that time, you must go and visit your doctor immediately. Now, what is the treatment for a cataract? Very early stages of cataract, you can change the glass number and still the vision can be little clear. But as the cataract advances, only treatment is the surgery. So now I just show you a brief video of that, how the cataract is done. I'll show you the surgery at the end of the session because it is not playing here clearly. Yes. Now, other disease is glaucoma, which is commonly known as a jhamar in Gujarati, or kala pani in Hindi, and kach bindu in Marathi, which is a common disease after a cataract where the blindness can be prevented and treated if diagnosed very early. Very unfortunately, we see lots of patients losing their vision because of glaucoma, because the diagnosis has been delayed, and glaucoma causes permanent loss of vision. So that is why it is not like a cataract. You have to diagnose very early and start treating. Now, eye is like a closed eyeball, and that is why there is a pressure inside. There is a system where the constant fluid is produced, that is known as aqueous humor, and it has been drained also continuously into the blood supply. Now, whenever there is an increase in the formation of aqueous, or when the drainage system is blocked or the drainage has been hampered, the pressure in the eyeball increases, and this increased pressure in the eyeball damages your optic nerve, and which can permanently damage your optic nerve and you can lose your vision. There are two types of glaucomas. One is an angle closer and one is an open angle. In angle closer, you can have a sudden increase in the pressure. Your eye pressure generally normally is between 15 to 18 millimeter of mercury, but here it builds up to 45 or 60 millimeter of mercury and cause a sudden loss of vision. But in acute congestive glaucoma, what happens is you get a severe pain in the eye, vomiting sensation, and redness and blurring of the vision. So many times patients have been taken for appendixectomy because they get constant vomiting. But that could be an acute congestive glaucoma. And so it can be diagnosed early and treated. But say something like open angle glaucoma, which is where there are no signs till you start losing your vision. There is no sudden rise in the pressure. Slowly the pressure remains borderline, like between 20 and 30 millimeter of mercury. You won't have redness of eyes, but slowly your nerve is getting damaged, and slowly your field of vision becomes narrower. And when you come to know when you have lost your vision quite a bit. So that is why early diagnosis and has to be done by routine eye checkup. Now, when does the glaucoma develop? Generally, it can affect anyone from children to elderly, but it is more common in elderly above the age of 45. It is genetic component also. So if you have a family history, your parents, brother, sister, anybody has glaucoma, there are chances that you may develop, and you must do a regular checkup of your intraocular pressure with an eye doctor. African countries, there is an increased prevalence of glaucoma. People who have increased pressure in the eye can develop this glaucoma, and people who have a short sightedness, that means those who are hypermetropic, those people who are using steroids can have a high pressure and can develop glaucoma. Those with diabetes can also develop a glaucoma. Those with eye injury can also develop glaucoma, or certain eye diseases can give rise to a secondary glaucoma, increase in the pressure and permanent loss of vision later on. Now, this is the normal vision. Now, what happens in early glaucoma? Their peripheral field of vision becomes narrow. At this stage, patient cannot diagnose, but if you are doing a routine checkup with your eye surgeon, he can diagnose, she can diagnose it and start treating it with eye drops, and you can prevent the further damage. This is an advanced glaucoma where field has become further narrow. You get a tubular or a telescopic vision, and at the end stage, you have only a central 10-degree of field, and patient cannot see clearly. And this, even at this stage, we start treating, we can only prevent the further damage, but whatever vision has been lost cannot be brought back. So the importance is of early diagnosis and prevent the blindness. Now, eye doctor can diagnose by doing a tonometry, gonioscopy. This is a field of vision where you can see your in the field of vision is gone in the upper field. And then this is the ocular tomogram, or we call it a CT scan of the eye, where the nerve fibers are damaged, which can diagnose an early glaucoma. Now, treatment of glaucoma in initial stages is by the eye drops. You can have 1 or 2 eye drops or 3 eye drops to control your eye pressure. If it is not controlled with the drops, you can use the laser, or even you can do the surgery. Now, one important thing is how to use the eye drops. I have seen many patients, they say that they're using eye drops but are not very effective, or they develop an infection with it. You should remember that you should never touch the bottle from where the drops are coming. So just open the cap and don't touch the tip of the bottle, but hold it from the base and keep it away from the eye when you're putting the drops, so that it doesn't touches your eye. Second thing is, you retract your lower lid and create a pocket to put 1 drop, and afterwards keep your eyes closed and you press it over the side of the eye in the center, so that the drop remains in the eye for a longer time and doesn't go in your throat through the drainage system. Now, another common disease nowadays is the age-related macular degeneration. This happens generally at the old age, after 65 or 70 years of age. It is nothing but a degenerative process of the retina. There are 2 types, wet and dry. Dry has got no treatment, but wet ARMD can be treated by giving injections in the eye. So it should be diagnosed early, then we can treat it, and which can be diagnosed by doing an ocular tomogram and fluorescent angiography. Now, here in age-related macular degeneration, what you have is a central scotoma. So patient sees that the center, they can see a black spot, or the center is not clear, but the periphery is clear. While in glaucoma, the peripheral vision is gone, but the center vision is clear. Here, it is exactly the opposite. Other common condition is diabetic retinopathy. This is because of the long-standing diabetes. If it is not controlled well systemically, then you can develop a diabetic retinopathy where the blood supply to the retina is reduced because of diabetes, and then the new blood vessels develop which are very weak and they start bleeding, and on the retina you get a bleeding spots. You can see this multiple bleeding spots, and which can be, if early diagnosed, can be treated with laser marks. What you see here, white marks, are the laser marks to treat the diabetic retinopathy. Now, what are the symptoms? They see such scotomas, meaning you see in between, you can see the dark spot. The picture is not clear, but those who have diabetes should regularly, every 6 monthly, go to an eye doctor and get the retina checked before they become an advanced diabetic retinopathy and difficult to treat and can give rise to blindness. So you get blurred vision, fluctuating vision, color vision is gone, and you can see such dark spots. The risk factor is duration of diabetes. The longer the diabetes, more than 10 years, 15 years, there are chances you will develop a diabetic retinopathy. If you have a poor control of blood sugar, your sugar is going up and down, then you can develop very early diabetic retinopathy. Other cofactors like blood pressure, high cholesterol, obesity can also develop a diabetic retinopathy very fast. Even tobacco use can give rise to a diabetic retinopathy very fast. So one has to be very regular. Those who are diabetic should do an eye checkup very regularly. So it can be easily treated in early stages by lasers, by intravitreal injections, and sometimes intravitreal steroids. But later on, if they develop lots of bleeding, then may have to be done by a treated with surgery also. Other common complaint is an eye strain. Now, because of the lots of digital media used, people get lots of eye strain at younger age group. And especially in this COVID time, because everybody is working from home, everybody is looking at the screen all the time, because there's an extended use of computer, mobile, your iPad. And sometimes even the proper posture is not there, proper distance of your books and your computer is not there, you can develop an eye strain because your blinking goes down when you are using this digital media. You develop a dryness of your eyes, and then what symptoms you get? Blurring of the vision. Sometimes you get double vision. Your eyes become red at the end of your 4 to 5 hours of work. You start getting irritation in eyes. You start itching your eyes a lot. Sometimes you get headache, which is very intense. You get burning sensation, feeling of disorientation in a severe eye strain, difficulty to focus after 1 or 2 hours of use of reading or a computer, and then you start watery eyes. We have seen that in lockdown, your media use has increased quite a bit, and which is a common cause of an eye strain. Now, certain healthy, to keep your eyes healthy and to prevent the eye strain and dryness, you can follow these tips, which is that you should have at least 25-inch distance for your reading, for your laptop, for your mobile, your iPad or computer. You lower the brightness of your screen and you follow the rule of 20-20-20. That is, after every 20 minutes, you take a break of 20 seconds and you look at 20 feet away. And if you follow this rule, then you can really be away from any eye strain or dry eyes. You can wash it with a clean water or a drinking water, or use frequent lubricating eye drops like artificial tears after every 2-3 hours of your computer use. And use the nighttime setting to minimize the blue light exposure on your screens. You consider turning off some of the overhead light on the computer, but you should not use it in a total dark room. The room should be well illuminated, but there should not be direct light falling on your computer or a laptop. And don't forget to blink your eyes or give rest to your eyes in between. And for a healthy eye, you must have a regular eye checkup right from your childhood. And don't delay if you have any complaints of blurring of vision, redness of eyes, watering of eyes, or you are seeing a double vision, or if you are a diabetic patient or a hypertensive or a glaucoma patient, and regular eye checkup is very necessary even at old age, because certain things like age related macular degenerations, if early diagnosed, can be treated well, and you can really delay the blindness coming to you. On this World Sight Day, let us pledge to donate our eyes and light up a life of other person and help the visually impaired to see the beauty of this life and beauty of this world. Thank you, everybody. I don't know. This is the cataract video. I just wanted to show that many people want to know how we do a cataract nowadays. You can see that this is a phacoemulsification technique. This is a probe which has got a small tip or a needle, which is only a 2.2 millimeter in size. So the cut in your eye is very small. The cataract you can see is made into small pieces. So all the small pieces are done, and then they are absorbed and sucked into this probe. So you can see that the whole cataract, the hard part, has been removed now. And nowadays we don't give injection also, we just put topical eye drops and do it. And you can see that the hard part of the cataract is removed. And then with 2 cannulas, we suck out whatever the small fibers are there. So you can see that everything is getting cleaned, and now you can see the red glow. That is the image of retina. So retina glow appears red once the cataract has been removed. And this is a foldable lens. So now the cataract has been removed from 2.2 millimeter, but the lens has to be bigger in size, the size of a cataract. So what we're doing is that injecting it through the same port, and it gets unfolded inside once it goes in the eye, and it becomes bigger in the size. So through the same small port, you can inject the lens, and then the wound is so small that you can just hydrate it, and you don't require any stitches to be taken. I thank everybody for watching my video. I'm really thankful to everybody for your kind comments, and I hope that my lecture was a little useful for everybody. Thank you, everybody.